rumors definitely has it that you scam your patients.
Unlike what people think, this job is very exhausting.
Exactly.
We are healthcare facilitators, so
In business, you have to be paid to survive.
I'm not yet married, but I'm taken.
Me, for now, I'm single.
First thing,
Your name comes up in a lot of things.
Hey,
Okay.
and it's only wahala of haters.
Haters.
Haters. You know, in India, we all know people like to gossip. Recently in India, friendships are fake.
because we want to do wahala.
Wahala.
People's secrets.
Yes,
I'm
I think
coming
like
for you.
hi everybody, welcome back to my podcast Unfiltered with Fatu. I'm your podcast, and today I have two of my dear friends that are going to talk about medical tourism. So today the team is going to be about medical tourism. So we're going to go a bit into that and then also the private lives. So I think I don't need any introduction for you guys. I think the entire whole of Delhi knows you guys already. But please take a minute to introduce yourself.
My name is Gufran Badruddin Mohammed. I'm from South Sudan.
But people know her as Nosha.
Yeah, around me in Delhi, people know me as Nosha. And I came to India as a student, so
That's a good point I want to evolve in later. And you, Mister?
Yeah, I am Philip Makop. People call me PM
Elon Musk.
or Elon Musk or Prime Minister,
Our
whatever you call it. I'm a fianced person and father of one.
Hey!
Yeah.
Clock it. So as I said, today we're diving into the world of medical tourism, why people travel abroad for healthcare and the opportunities and the challenges. So how do you guys get into the medical tourism?
So how did we get into medical tourism? So, initially we came to India as students, and as students we needed to look for a hustle to do, something to put food into your plate. So we discovered medical tourism was India was a prime destination for medical tourism. That being, we decided to facilitate the procedure, and then we discovered it's a fruitful business.
Same.
it was through my mom. She came for medication. I went to the hospital and I saw people are translating. You know how in Africa not everyone is capable of speaking English, and the communication also in India is hard. So I saw people working as translators, and it was small money. So as a student, small money is also money for us.
Yes. So one thing I want to point out is that India does actually not offer any work possibilities, so you have to create possibilities for yourself. And I think now a lot of people are also going into the medical tourism, right? Almost everyone is doing it. But you mentioned the point that it was India was a prime location. Why did you say that? Like, why India?
So India was a prime location because if you look at the statistics, India is one of the top locations for medical treatment due to its affordability. Many treatments are being taken over the world, be it elective surgeries or urgent surgeries, but India in terms of cost is the cheapest. So you will see people coming from Africa. Due to the lack of technology and availability of trained doctors in Africa, they'll look for the cheapest nearest country, and most of the times it's either India or Thailand. So yes, India is a prime location for medical tourism.
Oh wow, okay. But I think you started because of your mom, and I think you started probably because of your hustle. But from talking to you a lot of times, I feel like you've become a doctor yourself now. Like you really got into it.
Yeah. So
Everyone.
actually, in terms of training, I'm not trained as a medical doctor. Yes, I studied sciences in secondary school and I studied agriculture in India. But doing it, I started loving what I do. And if I love what I do, then I have to know what I do. So yes, I started taking lectures on my own. And yes, today people even call me doctor, but I'm not a doctor.
What about you? Are you getting into it, really into it?
Okay, me, I did my bachelor medical lab technology.
Okay.
I did my MBA also, hospital management and healthcare management. So basically, I have a background about how is it in the hospital, but right now, We are doctors. We can even do consultation. Even sometimes when you are taking the patient's reports, you know what the patient has. You know the patient suffers from. You can even do the consultation yourself.
Wow.
Yeah.
Wow.
But we appreciate the experience. We know more now. We acknowledge a lot of things that it's hard to explain.
But I feel like with time, you become pros with time. I feel like in the beginning, probably you don't know the terms, the medical terms.
It's scary.
Yeah.
So that's one thing you mentioned, because earlier you mentioned everybody does medical tourism.
Yes.
So, but I feel like it's wrong, because medical tourism is something which englobes a lot of services.
Exactly.
If you're calling yourself a medical healthcare facilitator, you should be a professional. You should know what you're doing. And a lot of people go into the business because they feel like it gives a lot of money.
Exactly.
And they are money oriented and not work oriented. So yes,
it actually doesn't give a lot of money. Some people are using the business wrong. Also, these patients, we have to know that these people are our families. Also, they're coming for treatment. They want to get it in most affordable way. Some people use that other ways, they scam the patients. The patient will come, you pay a lot, this. We've seen a lot of cases like that.
That's why I said they're money oriented.
Yes, we've seen a lot of cases like that, but I believe that it shouldn't be like that. You should. The patient is coming for treatment. Is coming, to get well. It just need help. What you can do it, and what can the patient do for you? Will do it also. If the patient will dash you small money. That's yes. It's also service is not for free, but it shouldn't be.
I really agree with you, because I feel like some people even sell their homes. They sell a lot of things to come here and to get their treatment. And then imagine after all that you get scammed.
You never know.
It's amazing you brought up that point. Getting back to you, rumors definitely has it that you scam your patients. And that you do organ trafficking, that you rise up bills.
Okay.
So, clarify, please.
So actually, I'll not say I'll clarify, but I'll go point by point. You say scamming the patient. So generally what happens before a patient visits India, we give him a pro forma invoice, which carries the tentative cost of treatment. And generally these pro forma invoices are based on the reports which are sent from Africa. So once they reach here, 90% of the time the diagnosis is wrong. So we gave him an estimate of 500 USD. We come and realize, you're not suffering from this disease, you're suffering from this other one. We quoted you 500 USD, but I'm sorry, it's now going to be 1,500 USD because of the new diagnosis. We haven't inflated the bill, we haven't scammed the patient, just that the patient, not being a medical practitioner, doesn't understand this. He just feels like his pocket is suffering, but we actually don't scam the patients. Second thing is about organ trafficking. India also is a prime location for surgeries such as kidney transplant and liver transplant. So kidney failure and liver failure are things which are very common in Africa right now due to the rise in diabetes and high blood pressure. So that being, transplants not being available in Africa, most people tend to visit India for transplants. So me being a facilitator and being a professional, I have a lot of patients coming for this kind of surgeries. So we facilitate for them. There are a lot of laws in India which guide the transplant, and organ trafficking is completely impossible in India. We do kidney transplant provided the patient brings a family-related donor and goes through the organ committee, which is regulated by the government of India. And once he gets approval from the government of India, the transplant is done. So it's completely transparent.
So you do it legal?
We do it legally.
Haters, stop spoiling his name. Oh, great. Talking about the money aspect, does it happen to you guys that a patient comes and they don't have enough money, and then you pity the patient, and then the money comes out of your own pocket sometimes?
So yes. So me, again, my patient flow is very high. So I've had almost every scenario. I can even go into a case I have right now. So the patient came for medical treatment. He had his treatment and the treatment didn't go well. Got into the ICU, stayed in the ICU for almost 11 days. And unfortunately, he passed away. So unfortunately he passed away, and he passed away with an outstanding bill of approximately 9,000 USD, which the family was unable to pay. So Hospitals in which we work are private hospitals, and private hospitals are hospitals which work for profit, unfortunately. But that being, we look for mechanisms whereby we downgrade the bill completely and make the patient pay for only the consumables and drugs which have been used on them and for nothing else. So the bill was brought down within the patient affordability. The patient could afford to pay for the hospital bill and the body return. Sometimes they are unable to pay for the bill. We look into the maths, we see if the drugs and consumables have been paid for, and we waive off every other services. So yes, we do that.
That happens to you as well?
Yeah, as I mentioned before, when the patient send the reports, we get the estimation of according to the report. So sometimes, they think this is what it is. So maybe the patient, like we face that a lot, they don't come with the exact, some of them they come with the exact amount you sent and other expenses. So it happens a lot in the hospital. A lot.
Coming back to you, like I feel there's a lot of men in that field and not so many women that are actually into medical tourism. Do you feel certain challenges because you're a woman?
Not really.
Not really.
I'm just a hustler.
So there's no discrimination, no nothing.
No.
Male patients don't try.
I believe what a man can do, a woman can do. Girl.
That's so true.
So,
but why do you think is that like the rate of like male in that industry is more than female?
Okay, so actually the rate of male to female is high because unlike what people think, this job is very exhausting.
Exactly.
So it's very exhausting. So from the time you wake up till the time you go to bed, you are available to provide services. When patients come to this country, the only person 90% of the time they know it's you. Like, I came to India because Philip convinced me to come to India.
Yeah.
So I'm about to buy breakfast.
It's a big responsibility.
I'll call Philip to order breakfast.
It's a big responsibility.
I have to take a
Yeah,
buyout. Your phone keeps on ringing like a call box
my
from the
God.
time you wake up till the time you go to bed. And that's the life we choose.
But also, I think like, does it have a toll on you guys like mentally? Because I feel like not only the hustle, sometimes you see a lot of things, then people who die, stories like sad stories and everything. Does it have a mental toll on you guys?
So for the mental part, in the beginning, yes, in the beginning we used to have some traumas, especially
We're fresh,
Yeah, when you're fresh.
Sometimes if you
Just
lose a
traumatizing
patient,
sometimes.
or
I
you
tell
see
you.
a surgical wound, or
Yeah.
you see some kind of foul smell coming from a wound or something. Yes, in the beginning it's a little bit tough, but with time you get along. What you don't get along is the stress, because sometimes it becomes really, really stressful to the point where you have no life. So at that point you're gonna explode, and sometimes we get to put our phones on do not disturb. If you notice, anybody who does this business is very difficult to pick phone calls.
That's true. I'm not sure it's not even available nowadays anymore.
Thank you.
Like we have to take appointments with madam. But is the profit good? But also I think like people have like different range and different incomes, because the income is not really fixed.
So coming to the income part, like I said, we are healthcare facilitators. So we charge according to the services we render. So I, for one, I'll talk for myself. So I have a whole company in Cameroon, and I have a company over here.
What's the name of your company?
Mari Medical Travel Consultancy.
Okay.
We're in Yaoundé, Cameroon. So what we do is we facilitate the traveling process from A to Z. We provide certain services for free, and some services we charge for. Example, we facilitate the visa acquisition process, and we charge a facilitation fee for that. We provide airport pickup for free. We provide hotel reservations for free. And we provide translation services for French and English for free. And if any other special requirement, generally we charge for that, because it will be an outsourced service for me. And then coming to other things, like if the patient visits India and takes treatment and all, yes, being facilitators, not everybody can be a facilitator. So hospitals have a system whereby companies are being mapped to the hospital, and the hospitals generally pay facilitation services fee. Hospitals, knowing that the patient needs facilitation, they pay for facilitation directly to those companies, and we don't need to overcharge the patient for that. So yes, we make money, but we get paid for what we do, nothing extra.
But I think like your own and hers are a bit different. Like you work for the the hospital and you get a monthly pay? No, nothing like that. So it's both the same. Like it's a freelance.
In this business, they say, in business you have to be greedy to survive. You have to, you don't have to. You don't need to have mercy.
Yeah.
But also we have mercy.
Yeah.
I have a heart that will not allow me to maybe scam you or charge you a lot. But I also feel like I deserve to be paid because I'm helping you.
Yes.
I'm waking up every morning. I'm picking your calls in the night. I'm attending to your emergencies. I'm translating to you. I'm doing all these things. You don't expect me to do it for free.
That's true.
Maybe because he has a company.
Yeah.
I'm an individual person.
Exactly.
So I don't have a company that will stand my back. Like I do my things alone. So I'll charge you.
I can I'll charge you. I'll charge you.
I'll charge you, yes.
Yeah.
But like I'm not going to add in your bills of the hospital, whatever. That's like the hospital bills, it's none of my concern. Even I can try my best to, talk to the hospital sometimes to discount for your beds and everything, but
that's it.
I believe for translation, I get paid.
Yeah. So he mentioned he's like French and English.
Yes.
You are Arabic, I think. Right?
Arabic and English, yeah.
Arabic and English. Great. And like, what's the, let's say, the biggest challenge you guys face on a daily basis?
So the biggest challenge,
or some of the challenges, let's say.
Yeah, some of the challenges we face sometimes is, like I mentioned earlier, when we have shared a pro forma invoice and when the diagnosis is made and the diagnosis is different, so the cost is different, then we need to make the patient understand that the cost is going to be different, and he refuses to understand.
Yeah.
So you get blocked at that point.
They'll shout at you.
Patients will
Thief.
start shouting at
Thieves.
you. They'll call you names like scammer.
Yes,
But
of course.
Yeah.
unfortunately, that's not the case. It's just because they are not medical practitioners, and I can tell you we hold no grudges for that. We understand, they don't understand. So yes.
Sometimes the patients are nice, the attendants are not.
That's what I was going to say. I heard that sometimes the attendants are like more difficult than the patient.
Then the patient will be like, someone is sick, just want to get the treatment and, get with it. Attendant.
These ones.
Attendant generally knows more than the doctor.
Really?
Of course.
The attendant is a whole doctor.
Even instead of the doctor asking them, they will question the doctor. They will show the doctor his work. No, you're supposed to do that. Are you not supposed to do that? I saw in YouTube,
Yeah. Oh my
Attendant is a
god.
whole doctor.
That's crazy. Okay, before we go to the rumor part or the rumor rubric, do you have anything you want to share about the business or say about the business?
Bring me patience.
Go bring it. Bring her patience.
Yeah, what I have to say about the business is right now, unfortunately, the regulations guiding medical tourism right now in India are not very, very tight right now. But I feel like they should be a little bit more tight.
They move more tight
They
so that
should
not
be-
everyone gets into it.
So that not everyone gets into it. And even if you need to get into it, I feel like come to us. We'll train you, we'll nurture you, and we'll make you grow, and we'll grow together.
Yeah.
They don't even need to come to us. Just like follow, You don't need to come. Of course, when someone starts this, they saw someone doing it.
Yeah.
So you saw that person doing it. According to what you saw, you behave. So I believe just have mercy on these patients. They are from Africa. They are our family.
Yes, but because I did see a lot of patients get
Have mercy on
scammed.
these people.
I saw a lot of patients being misguided.
By me?
Not by you.
No, by in
others,
India.
by others.
In India, some patients, even they come, it happens a lot that they come from the airport. It's also Indians these days. They take the Africans. You have a patient coming. Okay, they'll be at the airport. Oh, you want taxi? This. They take the patient to maybe another place. Then they will say, they will see the visa. In the visa, it will be showing where your invitation coming from. Maybe BLK Max, maybe any other hospital. So Indians now, they take them to another hospital. They go scam them while we're there.
I heard that.
They'll
That also
scam
people
them.
steal patients.
Yes.
Did that happen to you?
We call it cutting.
Cutting.
So they cut your patient.
They cut your patient.
Yeah, they cut your patient. So generally, yes, if you quoted the patient, let's say 5,000 USD, and then unfortunately someone else approaches your patient and he tells you, I'll fulfill the same thing he says within 4,000 USD. He cuts your patient.
So he cuts a bit. Wow. And that happens a lot?
Unfortunately, in this
lot.
business, you cannot have enemies. Trust me. You do not want to make enemies. Hey, in other business, you can be like, I don't I don't fuck with you, I don't like you, I don't, sorry for the word. But in this business, you can't.
Yeah.
Because 2 small words, your reputation is gone.
Exactly. I think like
this, patient is about trust.
Yeah.
If you shake that trust, your reputation is done.
Exactly.
So you don't, get work again.
Yeah. So I think like you guys' work is really based on mouth to mouth, like referrals. Someone comes, they had a good thing, they go back, they refer you guys, and also the trust
and attitude.
Yeah.
No matter how much your patient shouts, keep calm.
90% of the time that's the case, but sometimes if you want to get more flow, you need to do some things like visiting Africa with doctors, do consultations over there. We call it reverse medical tourism.
That one is big. It's not for us.
That was not for us. Too big things.
So yes, we do that.
Okay, perfect. So that was it on medical tourism. Now we go to a more personal base. So, are you married, taken, single?
I'm not yet married, but I'm taken. I'm in a long-standing relationship, almost 11 years.
11 years, guys. 11 years.
You're not married.
So we are entirely committed. I'm a very young person. I got mentioned my age. But if you subtract 11 years from
small
my
boy.
age, you understand
Not small picking.
Yeah, I'm a small boy. So yes, 11 years into a relationship, father of a boy. And yes.
The boy is your copy. I feel like such an injustice to the mom. You carry the child
I know,
9
right?
months, and it comes copy paste of the father. Like when you see his child, is his copy. Shout out to your wife, who's a great friend of ours, Manuela. I hope you're doing great. Yeah.
So you're selling me out.
You're selling. I had to make sure people knew who the wife is.
Oh yeah.
Like we consider her wife.
We love you.
We love her.
Our wife.
This is his wife because they've been together for so long. I mean, 11 years is not
since
11.
we knew him.
Yeah.
Since I knew him.
Yeah, and he seems to be a good guy. What about you, madam?
Me, for now, I'm single.
Hey.
This one thing.
Yeah, I don't want. No, we don't want wahala here. But yeah, let's get raw. I think even the host is stuck at this point. So rumor has it that you shifted out of your home that you were sharing with your boyfriend. I don't think we should mention names, but I think like everyone know who he is, and I think like you got into a bit of trouble, and then you shifted from your home.
Yeah.
Madam.
Sometimes it's good to have your own space. It is. It's even healthy, by the way.
So now you're single, ready to mingle.
You never know.
You never know. She's getting back to her husband so that you know.
We move forward, guys. We
move forward. This one is going back.
Girls.
Yeah. So, Philip,
Yes.
before I think you were maybe going out, but you were like more on the lower side, and now people feel like you're more out.
Yes.
Or is it just a circle you changed, or is this generally you're more out?
So before, if you noticed, I had a single friend, which was my partner, Manuela. So we used to go out, only 2 of us, and 2 of us were enough. Like we used
romantic.
to have a lot
sweet.
of fun. I haven't increased the rate of which at which I'm going out. I have just increased my friend circle.
Like us, guys.
Yes, I've just increased my friend circle.
Clock it for us, guys.
So that's why people now notice.
Yeah.
Otherwise, we had the same lifestyle, everything, just 2 of us.
Like, hey, that's his wife.
Shout out to the wife, guys.
Shout out, Manuela. Shout out. So, back to you. So, I had posted a link, right, where people could actually ask you questions. I did not take all of the questions, but like the most asked ones. So, Nosha, I think like they say like if you want any information, go to Nosha. She like literally knows everything. But at the same times, I think like your name comes up in a lot of things.
Hey.
Okay.
And it's only wahala. It does not come in people who want to make money.
Yeah.
Nothing. It comes in useless ways.
But why do you think like your name comes up in a lot of useless things?
Haters. Haters. What can I say?
What can I say?
Because, you know, in India, we all know people like to gossip.
Yeah.
And people who knows me knows how I behave.
Yeah.
If I don't know you, I don't know you. If I know you, I know you. If I know you, I die for you. I ride with you. If I don't know you, I don't care. But recently in India, friendships are fake.
Yeah.
You see, like it's so fake to the extent you don't even, you know, you
It's
be
like
scared.
even scary. It's scary to make friends nowadays.
You'll be scared, you get.
Yeah.
Like, now you'll see this girl approaching you. Oh, you look good. This. Oh, can I get your Snapchat, Instagram,
Yeah.
what? You guys start talk, meet. Now you'll be like,
Yeah.
And people just like to gossip, guys.
But I feel like for men, is it different? Like, how is friendship for men?
Men gossip more than women in India.
Yes, this is what
Hey, they play.
literally.
They gossip more than women in India
Yeah.
with evidence.
Me, I don't know
Yes,
about that.
they do actually.
Me, I don't know about that
But
because
one
I don't have
fact,
a lot of friends.
yes, but fun fact about Philip is, I think like one thing that I really appreciate about Philip is he does not gossip. Philip doesn't really gossip. Whenever there's a problem or whatever, he will say it's like it's none of his concern.
None of my business.
And there are not many people like you like that. Like, also he's very different with other people than when he's with your friends. I feel like the first time I met you, you were so strict. I'm like, what is wrong with this guy? He's so stiff. He wasn't talking. But then like eventually when you approach him, you'll be like, he's the funniest guy you'll meet in Delhi. I mean, like, this guy can talk. This guy can talk. But I think like it's great. I mean, like, it's not to everybody you should open up.
Yeah.
It's not with everybody you should sit. Not everybody should come on your table.
Yeah.
Not everyone should have like, let's say, the privilege,
Yeah, you should have the access code.
the access code
Yeah.
to you guys, you know. So that's that. And then Philip, there was actually recently a rumor
Yeah.
about you circulating with a girl. I don't really know. You don't want to mention names, so we're not mentioning names. But I do not know how the rumors really came up.
Okay.
But there was a rumor that you started dating or seeing a girl apart from your wife that everyone knows.
Our beloved Manuela.
Our beloved Manuela. So what's
So
what's the deal with that?
So actually, I'll never see any other woman than my woman Manuela. First thing. The second thing.
What's up, please?
The host.
Yeah. Now the second thing is, I'm a guy which was properly brought up by my mom, and my mom just taught me to be nice.
Mama's boy.
So, yes, maybe people saw me with someone being nice, but I'm generally a nice guy and generally no hidden intentions behind. I'm just being nice.
So you can say on this platform you only have one woman.
I can say on this platform and in front of everybody, I have only one woman, and I say it loud and clear.
I love it.
Clock it, guys.
Clock
Why
it.
can't you all be like Philip? Be like Philip.
Yes, be like Philip. Like, no, but it's true. I've never really seen you in any nonsense.
Have you?
No.
You know, in India, if like they see a man maybe being nice to a woman, oh, these two are these two are dating.
Yeah, even if
these
there's
two are
nothing.
seeing. Like there is nothing. It goes both ways. Even for us girls, if maybe like a guy just like it does. When you're in a relationship, does not mean that you have to just be.
Yeah.
And
You can have friends.
Yes, you can have friends.
I feel like there's nothing bad in having the opposite sex as friend. You just need to keep your barriers. And some people don't know boundaries. Some people have like
Keep your
I feel like
boundaries.
there's something bad.
something bad. Or you don't think that a male and a female should be friends.
So
I feel like a male and a female can be friends provided both of them are in committed relationships. Okay, so a guy in a committed relationship cannot be friend with a single lady.
Yeah, that's complicated.
Because generally, you see, this thing works this way. Any woman who sees another man treating another woman right wants to be that woman.
Never.
Clock it.
I'm telling you.
It's true.
I don't like to put my eye in someone's house.
That's you.
I changed the context. I'm telling
That's
you.
but there are a lot of women,
There are a
especially
lot
here.
of women. Let me tell you.
But I
Especially
believe
in
like
India.
you can have a pure relationship with a sister. Like you can take
No,
someone
no, no,
outside,
no.
like a
I'll
sister
tell
from
you.
Not
another
everybody
mother.
has the heart.
I'll
Not
tell-
everybody has the sincerity.
It's not about heart. I'm a man. Okay. You see, in India,
You are the issue then.
No,
It is
no,
not
no,
the
no,
friend.
listen to me to the end. In India, we are like lucky. We live above medium lifestyle and
True, sure.
everything. You see the way I treat my woman and everything. And I can tell you, my inbox is a place you want to be. It's a garden. You get a lot of hi hellos. But we all know the intentions behind these hi hellos. And we never attend to them. But because am I a fine boy? Is it because I'm too fine? No, it's not because I'm too fine. It's because you saw what you liked.
The money,
Then and you want to. So we just
But that's
like,
different.
No,
That's
it's
different.
But I feel like the point you took. I've recently been in a lot of these things recently where I find myself there's a lot of women who only want your man.
They don't
because
respect themselves.
They don't respect themselves because they see you're doing fine. They think, okay, now
Yeah,
the
the man is the one providing.
going for you.
Sometimes,
And
guys, it's not only the man.
Sometimes it's not the man. When you come, you go see.
Yes. It is not the man.
It's
Like
not the man. It's not always the man.
It's
or
us.
like
It's us.
it's
Never.
or like they come to you not like to a guy, for example, not just because they like you, but because of the girlfriend.
Yeah.
Sometimes it just they like have the let's say the goal is like, okay, it's not because they like you or they fancy you or anything, but because you're this person's boyfriend.
it's called jealousy. Let me
It's
just
called
put
jealousy, or because they want what you have.
They're just
but
jealous.
I feel like you men should understand that.
It's not jealousy. It's envy.
It's envy.
it. Yeah.
But let me tell you something. You guys are both like, let's say, doctors. I've read a research that says like all humans have envies and these are just like things that you're born with. You just have to control them.
Exactly.
Is that true? Like you are like you have these emotions, but just
I
control
believe it's more about how you have been raised.
them. That too.
Okay, and who raised you? Is it the street or home?
Yeah.
You understand? If they raise you well, you don't need to control it.
But
It will
there's-
go.
But there's also one thing. I feel like a lot of people when they come from Africa, especially girls, it's the first time that they have freedom.
Yeah.
And then even if the parents are good, if you meet their parents, you'll be like, oh, they come from a good home. Parents are good. They got like values back home. But as soon as they come here, they turn into something else.
It is who you circulate with.
Yes, I think also maybe who you circulate with.
Yes.
See, generally these things, I'll tell you, our parents will give us the best education they can over there in Africa. But being in a fence, like being in a house with parents where you need to return by 7 p.m. maximum
Exactly.
and everything.
Six.
Or 6 p.m. You'll not get exposed to a certain number of things. So controlling a child a lot never helps.
Yeah.
So like for us in Cameroon, when a child just gets advanced level, we send him out of the house for him to experience the outside world, because experience will teach you the lesson you will never learn from any person.
Exactly.
So I feel like when they come here, this is the time where they get these experiences. So 1 or 2 years, yes, they'll get these experiences. Then after that, they'll change. They'll transit to something else, either good or bad, depending on what lesson they get from their experiences.
90% is bad.
Okay, this is gonna be I think my last question before I get to you guys. So I think both of you actually live in Greater Noida, and whenever people talk about
Currently, I'm in Delhi.
now you're in Delhi, but you were in Greater Noida before.
But also, yeah,
Why is it
Greater
that
Noida is my
people-
second home.
Greater Noida is your second home. That's actually where your husband's
First home,
is.
actually.
Yeah, that's your matrimonial home.
Whatever.
Now you have just gotten out of the house for a while. So I'm like, why is it such? People have an opinion like, oh my god, like girls in Greater Noida is the worst. Boys in Greater Noida, like relationship generally in India or in Greater Noida, like doesn't work. It's the worst. Everyone is like mingled with everybody.
Okay.
Diseases that people pass on to each other.
Okay. So what I'll have to say is you'll have to look at the population niche ages. So most of people in Greater Noida are in their early 20s to 30s. Okay. Most of them are students or other professionals. I don't want to mention what they do. So
Ashawos.
ashawos. This is for ladies. Now we go. Now we go for men. Men now, there's a category of men who are scammers. Okay.
Yahoo boys.
Yahoo boys.
Shout out.
Who are Yahoo boys? So now let me combine them. You'll see a 20-year-old lady seeing a 30-year-old guy with a Mercedes Benz, promising her he'll buy her iPhone 16.
An expired one.
Expired one.
Promising her he will buy her iPhone 16. He will buy her Don Julio. He will do this.
Don't do
It's crazy.
He will do this. He will do that.
Yeah.
He will do it. He will get what he wants. He will dump her. Another one will come and do it. Another one will come and do it. Another one will come and do it. So
females, respect yourselves.
So
please.
this is
respect your body.
This is just what
I believe all of you can work for the money.
You can work.
Everyone can make money. Just need you to believe in it.
Because there's one.
You do not need a man to be giving you money. Women, they piss me off.
Since we won't depend.
Because what do you mean you depend your entire life you're depending on a man?
No,
you come from Africa to India to depend on a man.
No, they don't depend.
Exactly.
A Yahoo boy?
No, they don't.
As a matter of fact,
they don't
if you're responsible one, a Yahoo boy.
I tell you.
They don't depend on men. The human being is fascinated in such a way he always looks for comfort. You understand? No matter the way you take to get into the comfort, all you want is comfort. And ladies especially love comfort. So yes, they are not depending
Sweet
on
life.
men. They just want the comfort.
Soft, easy life.
But
we don't blame
the
them for that.
consequences after that, your reputation is gone.
It's not about reputation.
Just for the sweet
it's
life.
It's not about reputation. It's
What do you mean?
It's transactional. It's a transaction.
No, but reputation has a lot to do
A
with
girl's
a lot of things.
reputation
is everything.
is worth unlimited millions than a man's.
That's true.
So this is the mindset we have because we are Africans, but I think in Europe, there's this culture of having a buddy or something.
But I feel like one thing about Europeans, like one, they're direct.
Exactly.
One, they know what they want.
Exactly.
One, they take responsibility.
This is why they're not dying fast.
They're not dying fast. They know what they want.
They're healthy. They're happy.
If they want to be just friends with benefit, they will tell you that.
Exactly.
And they will not they are truthful.
Exactly.
If they're a shao, they will tell you I'm a shao.
Exactly.
If they are this, they will tell you I am this. They're not afraid to be.
But now this is a problem. The problem is because they live in a non-judgmental community.
Yeah.
The problem is right now here what we are doing is judging. If we were non-judgmental, I bet you everybody will chest up. I
This
am a
Africa
shao.
for you. It can
I
never
am
happen.
this.
This can never. Yeah.
They
So
judge us since we are.
that's why I
Yeah,
said
they
it's
judge us
about
women.
it's about the community.
It's
So,
also about
yeah.
the community.
Yeah.
Okay, guys, since we're coming to the end, any questions do you want to ask the host?
Any questions we want to ask
the host?
Yeah.
Okay. Where do you get your money from?
Yes.
That's my question.
Good
Where you
question.
get your money from?
That's a good question.
So I think like a lot of like, I don't want to be hypocritical saying I hustled all my life. That's the general thing.
She's a rich babe.
No, I come from a comfortable, good home. I think most people know how I got to India. My father was stationed here, and well, I always liked to hustle. Even when my dad was here, a lot of people. And my first job was in a call center in Noida somewhere. Even though my dad was here, I used to struggle all the time. People used to, but your father is this. Like, why would you? I always wanted my own money, so I started working early.
That's the spirit.
That's the spirit. Like, it's not like I lacked anything with my dad here. You mean? But I always wanted my own money. So I started like working like really young to save. And the fact that I did not have to pay for anything because I already had my dad, I think that was like a big advantage for me because I just kept the money and just saving. Like I started working when I was 16, even though I didn't have to.
Okay.
You know, I think that was a big point because I don't want to be sitting here and say, it was all hustles and this and that. I did hustle a lot, but it's not only that. I think like my background was like a huge thing. So I hustled a lot. I 9 to 5 jobs. I had a lot, and then also I invest. I always tell people, 9 to 5 job does not get you rich, unless maybe you're an ambassador getting 15K a month or something, or like your really paid job, but it doesn't really make you rich. You get the money, you invest. You get the money, you invest, and that's how eventually you grow.
It grows.
You grow, and like also like I think like great friends who motivate you, like all of you. Like,
are you the one sponsoring your lifestyle? Traveling, going out, all this.
I sponsor my lifestyle to 95%. 95%, I say
Period, girl.
when I was younger, I think like I used to scam off my dad a lot. That man don't suffer. Like $20 and all that. I used to scam that man. But we cool, daddy. So, but like I think like when like I got my job at the embassy myself, I cut off my dad and like I was doing it all myself. There was a time I was sponsoring myself 100% because I didn't need the money from my dad. You know, I didn't need the money from anybody. So then I got my man where's money, so I'll eat my man's money as well. That's why I'm saying 90 to 95% because it's been a while. Like I like to be soft. Like I like to eat my man's money. So it's not like he doesn't give me money. Like
you like to eat only his money? Or?
Yeah, like good women being independent.
Brother,
eat your
keep
money.
that money. She has money.
He can't. You know that. Like that's also the thing. Like when I feel like when you date an independent woman, you know that she doesn't need your money, but still you'll pamper her. You give her the money, and I know most of times he knows I don't need his money, but he'll still give it.
I need it. What do
you
mean?
need it?
What do you mean I don't need your
like
money?
For example, me, I have my own money, but like he knows like my nails,
Every
my hair
girl has her
to be my
own
man.
money, but they love that man's money.
Yes, make your money, but don't forget to eat your man's money.
Oh my God.
Yes, but like I know where the question's coming from because probably a lot of people say, I hear the rumors, oh like I'm dating my man just because of his money
And his car.
and
his car.
in his car
And his car. And his car.
and his car.
Yeah.
I don't want to get into debate about the car. Whatever me and my man has is ours. It's our home. It's our car.
Communauté de bien.
Yeah, communauté de bien. So I'm never going to go into that. Whose car is this? Whose house is this? Whose child is this? Whose what is this? Whatever we have is ours. Whatever we're going to make in the future.
These are financial things.
Huh?
These are financial things. They don't even last.
Exactly.
So
These are material things. I never.
people should stop talking about
Yes,
people.
I never care about the car or the money, and he knows that like whatever we have is ours. And I feel like every successful woman, like couple, even like look at Jay-Z and Beyonce, you would never know whose is what.
Yeah, look
true.
at Philippe and Manuela.
Look at Philip and Manuela. How
Look
do you
at
know
me,
whose
guys.
How do you know whose is what? Whatever you make as a couple is yours.
Yeah.
Like the kids, you don't tell the kids this parent's
This
kid.
is yours,
This
this
is
is
our
mine. No, yeah.
children. This is our home.
True.
This is our whatever we have, and that's it. And if you,
That is a mature relationship. Come to Greater Noida. You take care of me.
you take
You
care.
pay my rent. You do so. But also you're just lazy, sleeping at home, doing nothing, gossiping about people.
I tell you, like guys, I mean like. Gossip comes also from a place where I think like people don't have much to do. I feel like
Yes.
when you're busy, you don't have the time. It's when you're not busy.
Exactly.
If you see me getting involved in anything, it has my name, my husband's name, or he's connected somehow. But seeing me gossip about other people like that, like I only gossip, like talk about things that concern
No,
me.
I know for a fact Fatu is straightforward.
Yeah, I'm very straightforward.
She will tell you. I know
I'm
that.
very straightforward. And I think like one thing I like both of you, because people ask me a lot, like, why are you friends with these people? Like, what do you have in common? You're from this, they're from it. Like, we're not from the same background. But I think like one of the things that I really appreciate about both of you is that like you're direct. You're direct, you're not fake. The way I see you is the way you are. You understand? And I feel like once you know your friends, no matter what comes from outside, it's just noise.
It's just nice. Yeah.
True.
So yeah, guys, thank you very much for taking out your time and coming. Though they came 1 hour late or 1.5 hours late.
Said it, she will
So
say it.
I will say it. Yeah. So also very thank you to the production and the podcast studio for being patient with us and like for allowing this to happen even though they came late. So I told him whatever price is gonna be there for the
She
extra
mentioned it
hours
She mentioned it
they're
again.
going to pay.
We're very broke.
No, this one is Elon Musk. Look at him, USPA.
USPA
Look at his
everywhere.
shoes.
You
Look at
see?
her. And like,
Excuse me.
so this is Elon Musk.
A bit
And
small
who
picture.
are you, Oprah?
My name is Nosha.
I.
Only.
So they pay for the extra hours, yeah.
So yeah, thank you for hosting us.
No.
I
Thank
hope
you so
you'll
much
call
for
us
having
again.
us.
Of course, I'll call you again. Maybe on my season 2.
Yeah, because we want to do Wahala.
Wahala!
Next time.
Yes.
Yeah, it's not going to be about business, guys.
Yeah, it's
No,
going
next
to-
time it's gonna go maybe.
People's secrets.
Yes,
I'm
I think
coming
like
for
next
you.
time it's gonna be like the entire group.
Yes,
Yeah.
We're gonna sit and
It's gonna be gossip.
there's gonna be
Not gossiping, exposure.
exposure. We're direct. Gossiping is like
Exposure.
It's direct. It's direct.
We don't gossip. We tell you right in front of
I
your
leave the
face.
wahala.
Okay.
Okay.
By the
guys.
way, Wahala is his middle name.
Yeah, you are Wahala.
Ah,
like
never.
this one is Wahala. This one can fight. This one is Wahala. This one is Wahala.
To be honest, they people like think that I can fight. Okay, I can, yes, but I don't know how to
Better
fight.
keep quiet. You
Physically,
have friends like Philip. Eh?
physically is
Look at him.
hard.
Look
I
at.
cannot
But
fight.
I cannot-
come to lele, I'll finish you.
Can't finish you. Okay. Thank you for watching and keep up until the next time.